Clinical Officer for Hartford Healthcare. We'll start with some of the details regarding the number of patients we're carrying in Hartford Healthcare today. We have 98 patients in our acute facilities. Bacchus Hospital has 3 patients. Charlotte Hungerford has 3 patients as well. Hartford Hospital has 35 patients. That's the lowest number we've seen for a long time. Midstate Medical Center has 8 patients. St. Vincent Medical Center has 34 patients. Hospital Center Connecticut has 14 patients. Wyndham Hospital has 1 patient. These are the 98 patients we have in our acute facility, but 14 of them are intubated at the moment who are on ventilator, and rest all are being cared in our non-intubated areas such as floors and high flow oxygens and other things, which is a positive sign. We haven't talked about the ventilator for a long time, but the utilization of ventilation obviously has gone down as well. This is a very positive number for Hartford Healthcare, and especially for the community as the number of hospitalizations decline. We do have another 146 patients we're carrying in a community network through our home health services, through our nursing homes and assisted livings and other areas, and 2 patients in behavioral health network. As a reminder, everybody, that we were one of the earliest one to create a COVID-only behavioral health network location, which is testament to our commitment to the community to support patients who have this difficult challenges clinically. Now to move to the next topic is we had a wonderful Healthcare Heroes Month celebration. We started with the Nursing Week and other healthcare hero celebrations. The Lifestar will be conducting a flyover in all Hartford Healthcare regions and hospitals today to honor the heroes who have kept our patients and communities safe during this time. And this has been quite a testing time for all of us, and I think it'll continue for some time. But this celebration, this flyover, is so meaningful to many of us at this time. And I'm hoping that many of you can join and witness the wonderful event. We'll send out the schedule in detail. This is scheduled to begin at 12 noon today. I have some updates regarding the mobile testing sites and overall testing. We've done more than 44,000 testing. Mobile community sites in May in itself, we've done 28 of those, 28 mobile testing visits. State of Connecticut employs 9 places. We've done 2,536 mobile testing so far. We've done 29,000, close to 30,000 drive-through testing, and total year-to-date 45,845 testings we've conducted from Hartford Healthcare. Now, this is a significant number for an institution who's actually done amazing number of testing in such a short time. And today, the Hartford Healthcare mobile testing program joined forces with local businesses and organizations. And we are asking the residents to get the test. If you have symptoms, if you're concerned, if you're thinking about going back to work, get the test. We are here to help and support. Today, Hartford Healthcare will open the free testing in North End of Hartford at the Artists Collective. There will be a press conference at 1 o'clock. It'll be in the partnership with Artists Collective at 1200 Albany Avenue, Hartford. And this will make Hartford Healthcare's 50th mobile station spot. That's a tremendous amount of work focused on the access to the places where it's difficult to get access for the testing. With that, we at this press conference, we would have Mr. Jeffrey Flex, our CEO and President of Hartford Healthcare, Matt Ritter, House Majority Leader, John Larson, U.S. Rep, Sean Wooden, CT State Treasurer, and Janice Fleming, Voice of Women of Color. They'll all be present at that time. Today we have a special treat. We have one of my colleagues, Dr. Peter Yu, who's he's our institute lead for the Cancer Institute and leading contributing site. He's leading the Hartford Healthcare site for the cancer study published in Lancet. Clinical impact of COVID-19 on patients with cancer. It's a cohort study. So Dr. Yu, Physician-in-Chief of Hartford Healthcare Cancer Institute. Thank you.
Thank you. Thank you, Ajay, and good morning to you all. As Dr. Kumar said, I am Physician-Chief of the Cancer Institute at Hartford Healthcare. I'm also past president of the American Society of Clinical Oncology, or ASCO. I mention that because this past weekend, ASCO had its annual meeting. This is the largest meeting of cancer physicians and scientists in the world. About 40,000 people participate. This year we did it virtually, as you can imagine. At our meeting, we had a special session on the impact of COVID-19 infections on patients who have a diagnosis of cancer. There is very little known about this, and it was very important to get this information out early. We had 2 studies that were reported at our meeting. The first of about 1,000 patients with cancer and infection at the same time was reported by the CCC-19 registry, which is led by Vanderbilt University, and which Hartford Healthcare is a key component member of. That was 1,000 patients. A second study, which was done from Europe, looked at 400 patients with lung cancer. So combined, we have 1,400 patients with cancer who had COVID-19 to look at. The key messages are, first, that there is a higher risk of dying if you are a cancer patient and get infected with COVID-19, a risk that's about double, 13% compared to 6.5%, which is the mortality rate in the Johns Hopkins database. Message for that is if you have a patient with cancer, you need to be very, very careful about social distancing and other protective measures so you do not get infected. That does not mean that you can't be treated for your cancer. Obviously, cancer is not something that's going to wait, or if you do wait, it'll get worse. So the studies show that patients who had surgery within 30 days before they got infected did not have a higher risk of dying. So getting surgery and then having an infection after the surgery was not as deleterious. It also showed that there are other ways to treat patients with cancer. Treatments such as hormone therapy, which is commonly used for breast cancer and prostate cancer, did not have an increased risk of dying. Treatments with our more modern precision medicine agents also did not appear to have a greater risk for undergoing treatment. Chemotherapy remains a major treatment for patients with cancer. It is reassuring that patients who had earlier stage cancer, who are not very symptomatic, who did not have other serious health problems, could get chemotherapy and did not appear to have any higher risk of dying. On the other hand, patients who were with more advanced cancer, patients who had more symptoms or other diseases, did have a very high risk of dying with cancer. Clearly, these patients should have their cancer treatments deferred until the infection is cleared, which brings us to the question of testing. Since so many patients with COVID-19 may not know they have COVID-19, they may not have the symptoms, how do you ensure that this patient that you're about to treat, if you're a physician, doesn't have an active COVID infection? We at Hartford Healthcare have a policy of testing. We test every patient immediately before surgery to make sure that they are not infected. And we have a policy now that any patient starting a new course of chemotherapy or a new course of radiation therapy will be tested for COVID-19 immediately before they start treatments, and we will be prepared to adjust and make a decision on an individual basis if there is signs of an infection. So I think the take-home messages are, one, that cancer patients need to be extraordinarily cautious about infection. They need to maintain social distancing, even as others in our society start to enjoy loosening up a bit. Our cancer patients need to remain ever vigilant. And testing is very important. We need to do that often and frequently to make sure that our patients are staying safe. I would also say that the risk of getting infection is not in the hospitals and in the clinics and offices. The risk of getting infection is in the community. That's where the virus is. And so patients who are being treated for cancer, most of them are not in the hospital, need to be vigilant. So with that, be happy to answer any further questions.
Doctor, good morning. Bridget from the Republican American. Can you go over what you mentioned about patients who have surgery and the 30 days with risk factors?
Yes. So this is not a formal study. This was a voluntary effort from about 100 now participating centers, mostly in the United States, but Canada and Spain. And they reported what happened to their patients. So we looked at those patients and said, of these patients, about half of the patients, about 500, had active cancer, were being treated in some manner. So when we looked at those 500 who were being treated, we looked at those who had had surgery done, cancer surgery done, in the 30 days before they were discovered to have an infection, and looked at that population and said, did they seem to have a higher risk of dying? And we found they did not.
Okay, thank you.
I would also say that cancer patients tend to be older than the general population. They tend often to have other diseases, and that can be part of the reason why patients with cancer do not do as well if they get COVID, but it doesn't explain the whole picture. Our patients with cancer are caught in a rock and a hard place. They have one disease, cancer, which is life-threatening and needs treatment, and they have a risk of COVID, which they need to be vigilant of. And balancing those two is very much an individual decision between the physician and the patient, balancing the risks and the situations.
Hi, this is Mel from WTIC. Sorry, just a quick question. Do we know if in Hartford Healthcare if there are any cancer patients with COVID-19?
This registry, this reporting, was looking for patients at Hartford Healthcare. They could be in the hospital, they could be outpatients who got a diagnosis of COVID-19. We found about 55 patients, not many, concerning how many patients we have who have COVID infection. It was these 55 patients whose records we went through to understand what happened to them, what kind of treatments did they have for their cancer, were they hospitalized, were they in an intensive care unit, did they receive any treatment for COVID-19, and what kind of cancer treatments were they receiving. So they definitely are patients at Hartford Healthcare who have cancer who do have an infection. So this is being looked at across the world. The National Cancer Institute has also launched a formal study which involves collecting serum and other things to get a firmer database. But definitely it's in the community and it's in Hartford Healthcare and our patients, and we're extremely vigilant about finding out, identifying those patients, and also making sure that in our clinics and offices and hospitals that we have a safe environment with social distancing. Our staff is checked every day for infection or signs of infection. And we have special procedures to clean our room every time a patient comes in for a visit. Before the next patient comes in, we clean that room and have a decent time for air exchange to remove any viral particles that might be present. So we are following all those procedures and more.
Hi, this is Eva with WFSB. Just kind of going back to the very beginning where you mentioned the two studies. Can you just outline those two studies really quickly once again for our note-taking purposes to make sure we've all got it right?
Yeah, certainly. So the largest study, which at the time of the data analysis had 1,000 patients, now there are over 2,000 patients. That study started in mid-March. It actually started through social media. A lot of us cancer doctors know each other, and we use social media. And the idea was put forth, let's pool our data. We all have fairly sophisticated medical systems with databases. We were quickly, within a couple days, able to launch this effort, and within a month acquired these 1,000 patient records for data analysis. The data is stored at Vanderbilt University. That study involves patients from the United States, Canada, and Spain. The second study was started in Europe along the similar lines. It was really started by the Italians who had the greatest outbreak. And that study was started by the lung cancer community physicians. And so that 400 patient study is focused on lung cancer patients.
Thank you for that. And for people that might be watching this or seeing this later on our different media outlets, what would you encourage maybe families and cancer patients? You were talking about the balance, that it is tough between balancing COVID and cancer. What would be your recommendations to them as they're kind of navigating these tricky times?
Yeah, cancer patients, we certainly hope, and most of the times cancer patients are not just a patient, they're patients surrounded by a family and a community of friends that support them. And it's that larger community that helps our patients get through this. Sure, the doctors, the nurses, the pharmacists, they all help. But really, it's the friends and families who support these patients through their cancer journey, through very, very dark times. I think this community around the patient needs to support them in many ways now with COVID. So difficult as it is to maintain social isolation, difficult as it is to wear masks, difficult as it is to not visit your loved one if you're feeling sick, I think these are critical steps that need to be done to protect your family and your loved ones.
Thank you.
Doctor, it's Bridget again from the Republican American. Just curious to know whether you found any differences between the types of cancer and the risk. I know that the elasticity of the lung has figured very prominently in the risk factors for COVID. So I wondered if lung cancer had a higher risk factor than other types of cancer.
Yeah, that's an interesting question. So, there are a lot of burning questions, and these registries will continue going on as we start to delve into these. In the larger study, the 1,000 patients, any patient with any kind of cancer, there did not appear to be a type of cancer that stood out as having a worse prognosis. But that may change as we get more numbers. Certainly, cancers were well represented. The most common cancers, breast cancer, lung cancer, colon cancer, prostate cancer, were well represented. But in that data, it didn't seem to show a big difference. We know that certain kinds of cancers are have treatments available that are less toxic than chemotherapy. I mentioned hormone treatments for breast cancer and prostate cancer commonly used. Precision medicine, we call them TKIs. Those are oral medicines. They have fewer side effects. And so cancers that have those kind of treatments available, I suspect will probably do better as the data comes out. The European study, which focused on lung cancer, showed a higher mortality rate than what we saw in the United States in the general cancer population, suggesting that lung cancer patients may in fact have a worse prognosis. That wouldn't be a big surprise, considering that the major cause of death of COVID-19 is pneumonia and respiratory failure. So that is something that we need more follow-up and more numbers, but certainly lung cancer population is someone to be particularly worried about. We have a very close relationship, a formal affiliation with Memorial Sloan Kettering Cancer Center, and when I asked them how their experience has been, interesting that bone marrow transplant team, Dr. Girault, who heads that, those patients are the most immune compromised. You've taken a patient in a transplant, you've removed their bone marrow, which is effectively their immune system. He actually surprisingly said that his patient is doing very well because social distancing and isolation is something that's part of the routine care of a transplant patient. They isolate, they wear masks, they get frequent testing for all sorts of things. So I think there is probably going to be a difference as this plays out in the type of cancer, layered on top of that, the type of treatment that patient is getting, and layer on top of that the degree of protection we have with social distancing and other measures.
Thank you.
You're welcome. So I'm happy to answer any other questions. You can email me at peter.u@hhchealth.org. Happy to answer any questions that come up.
Thank you, Peter. That was wonderful. If you have any other questions or comments, I'm happy to hear that. And if not, then,
Dr. Kumar,
yep.
I have just one more question. Do you see now we are sort of going down and down and predictably with fewer and fewer hospitalizations? Do you see a point where we will see few, if any, hospital patients in the coming weeks before we look forward to the fall?
Well, I think our prediction has been that we would see a very small amount of patients who would come to Hartford, any hospital across the state, and that would continue through the summer and the fall as well. Hoping that there would be no patients in hospital with COVID is somewhat unlikely. That we would have a very small number of patients who would be coming. This virus is going to continue some activity as physical distancing and the warm weather and congregations and other things. Hopefully, less. But if it comes back, we would see some patients would come back. I think the point here is that we started the conversation back in March. Is how do we flatten the curve and how do we sustain the activity in the community in a way that our hospitals and our healthcare system continue to deliver the care. I think we've reached the point here that we've flattened the curve quite well. We've actually managed in such a way that the low level of activity we can manage and contain and mitigate as we go forward. And we would see some hospitalization with COVID-19 related over the time. It would not be as pronounced, obviously, as it has been, and hopefully will continue to be controlled as we go forward.
Thank you.
Hi, Dr. Kumar. This is Danielle with WTIC. Are you concerned that we may see some more, perhaps an uprising cases again due to the protests that have been held across Connecticut, especially this past weekend?
Yeah, that is a concern, obviously. We've seen a large number of crowd gathering. What I can at least make out looking at the photographs and videos, large number of people are wearing the mask, which is a good thing. However, the social distancing or physical distancing is somewhat difficult to manage in those crowds. So I think there's a concern about increased exposure. You just need one or two people actually who have symptoms and who's exposing to the other members, and it'll spread again. So there is a concern. So we'll keep a close eye on that at this time.
Okay, thank you.
Any kind of gathering we have, whether it's a crowd or any social events, does pose a risk of something like that. And that's why the physical distancing continues to be an important factor in reducing the exposure as we go forward, till we have vaccines, till we have a better medications and treatment available for us. Tina, you have a question on Facebook?
We do. What is the latest opinion on immunity for COVID survivors?
We still are in the early stages of understanding the meaning of immunity. We've seen that individuals actually who do recover have some sort of a IgG or IgM antibodies present. Are they neutralizing? Are they able to fend off the future infection is yet to be determined. The studies are still ongoing, and we will learn over the next several weeks on that part here. These studies takes time. It requires a large scale to be able to make a definitive comment on that. So some more information will come. But right now, as of today, I think we will treat immunity not as a guarantee for future reducing having an antibody is not a guarantee for immunity. Very good. If there's no further question, I'd like to remind everybody, as we go forward during the summer and the fall, physical distancing, isolation, hand hygiene, personal hygiene, staying away from individuals who are sick. But I do also want to remind that the hospitals like Hartford Healthcare and many other hospitals across the state and country are doing all they can to make sure we contain the spread. We are able to provide the care who needs it the most. We've seen several incidences when the patients have put off their essential care, and that could cause a long-term concern. One of the concerns I've had, at least, that the folks actually who are delaying the chronic care, hypertension to be managed, the kidney failures needs to be managed by the medical and other specialists, they're putting that visit off. and it could lead to an increased in chronic disease-related complications in future. So my request would be that if you do need to seek care, when you schedule for your visit, when you're supposed to see your doctor, please continue to do so. This is a long-term strategy. A lot of healthcare we provide is a prevention nature, and if you don't have the prevention, we can cause a further problem down the stream. We would encourage everybody to seek care when it's appropriate. The hospitals have done, especially the Hartford Healthcare, has done tremendous amount of work to make sure that we operate safely. We have a checklist, we have audits, we have all sorts of processes right now in place. In fact, we're testing all the non-clinical employees as well who are not in the clinical area with screening tools as well. So Hartford Healthcare has taken all the steps possible at the moment to keep you safe. Thank you.